is my video for Skills Lab on deep tendon reflexes. This is my patient Lily. She has gladly volunteered to be a part of this video. In the video, I'm going to demonstrate on Lily how we assess deep tendon reflexes. They are, and what spinal cord, what area of the spinal cord may be affected if there's an abnormal response. They're rated from 0 to 5 with about a 2+ being normal. So we're going to start out with the biceps reflex first. So I'm going to have you just gently pull up your sleeve. You want to palpate, relax your arm for me. And we're going to palpate for the biceps tendon and make sure that the patient's arm is bent and that they're relaxed. So you're going to strike the arm on your finger, on your thumbnail, right over their tendon, and you should be able to see either some flexion of the arm. It probably won't be that noticeable, but you will be able to definitely see or feel it in their muscle. Next we're going to, and that would indicate if there was an abnormality, damage in C5 or C6. Next we're going to do the brachioradialis, so just moving down the arm. So again, you're just going to relax your arm, please. And if your patient is having trouble, if you're having trouble getting reflexes, you can ask your patient to clench their jaw or like focus on something else to try and help them not to think about this. So this is going to be located above the wrist, but like I'd say, so she's little, so it's kind of hard, but it should be like 3 to 5 centimeters above the wrist. You're going to again strike, so just relax. We're going to strike with the flat edge of the hammer, and we'll see a little jump in the fingers there. So that will also indicate a problem with C5 to C6. Next, we're going to do the tricep. So for this one, it's a little bit harder. So sit up straight for me, okay? And I'm gonna have you just rest your arm completely on my hand. Like, let me hold your arm like you're a scarecrow. So just let it dangle there, like this is a nice little shelf, okay? Good. So I'm just gonna rest the patient's arm on my hand, and then I'm gonna feel for the triceps tendon, and I'm going to, okay, now I'm gonna have you clench your jaw really tight and relax your arm as much as you can, and then I'm gonna strike right on the triceps tendon. This one's a little challenging. Nothing. Oh man, we might have a problem with this one.
Her fingers were flicky.
Let me try your other arm. So I don't think there's really a problem. This one's just a little bit hard to get. So fully relax. Just let your arm hang. So if there was a problem with this reflex right here, that would indicate. So I can feel the reflex in my hand. Actually, I can feel the muscle reacting. It's just not very visible. But if there was a problem, that would indicate a problem between C7 and C8 in the spinal cord. We're going to move on to the patellar reflex. So again, we're going to feel for it. So it's going to be, here, let's dangle your little legs down off the table. So just relax your leg completely. So you're going to feel right where the patella is, and then right underneath it, there's like a softer area. And that's where you're going to strike with the hammer. And again, just sometimes you might need to distract your patient a little bit. So we're gonna think of something else, right? Oh, there's a little bump. Let's try again. Can you clench your jaw for me? Actually do this with your hands. Squeeze your hands really tight. There we go. So if there was an issue with this reflex, it would indicate an issue in the lumbar part of the spinal cord between 2, 3, and 4. Next up is the Achilles. The Achilles, you want to hold your patient's foot while you strike it. So the Achilles tendon is very easy to find. It's right back here. You're gonna go a few fingers above the heel. And then when you strike the Achilles tendon, you're going to feel the foot flex. So the foot's going to point downwards toward onto your hand. If there was a problem with that one, that would be a problem in S1 and S2. The other reflexes that we can check, which normally we wouldn't check on an adult because they don't, or I'm sorry, it's normally checked on a baby, is the Babinski's reflex. So you're going to use the opposite side of your hammer and you're going to do a upside down J. So you're going to start at the heel and curve up towards all of the toes. And you should see the patient's foot. This is going to tickle. So you should see the patient's foot curl down. Babies, you're going to see it extend out and their toes are going to spread apart. So with Lily, she's just really ticklish, but her toes are just moving all over the place. That reflex can indicate problems in the adult between L4 and S2. On babies, we will assess a rooting reflex, which Lillian will no longer have anymore, but I'm going to demonstrate on her anyways. So with an infant, basically the rooting reflex is just stroking their cheek with your finger, and they'll turn their head to the side that you're stroking, looking for a nipple or a breast, because they're hungry. The other reflex that we would check, and it should be on both sides, so either side that you stroke on the baby, they'll turn their face to that way. Another reflex we would check is their palmar grasp. So babies instinctively will, if you put your finger in their hands, they're going to grasp your hands. Hold on. Yep, and they'll just hold on to it. So we're gonna check that. They'll also do the same thing with their toes. And another reflex for the babies that we would check is the tonic neck, where if you have the baby laying flat, you turn the baby's head to the left side, their left leg would extend out and left arm would extend out, and their right arm and leg would flex up and in. So those are the reflexes that we would check for the babies, and those are the deep tendon reflexes, and I don't think I missed anything. Thanks.